I'm Dr. Roger Whitman, Chief of Pediatric Orthopedic Surgery at HSS.
My name is Dr. Lisa Ip. I'm the Chief of Pediatric Medicine at Hospital for Special Surgery.
My name is Dr. Kate Del Pizzo. I am the Director of Pediatric Anesthesia at Hospital for Special Surgery.
So patients come to HSS for the outstanding orthopedic care that our surgeons provide to our patients. Once they're indicated for surgery, they enter into our pediatric perioperative program, and the nice part about that program is that it's much in advance of the surgical day. We have an aptly called preoperative appointment that takes place to gather all the information, the patient's medical history, surgical history, subspecialty notes and records, and all of that reviewed with the family. And at that point, the surgical planning process starts.
Once they've completed their workup, we'll do a complex case conference, and that's really the opportunity for our pediatric anesthesia colleagues and our pediatric ICU colleagues to participate in planning for the surgery. What are the needs perioperatively, what are the needs postoperatively, and really just being sure that we can address all those needs within our system.
The group is interdisciplinary, including the pediatric orthopedic surgeons, pediatricians, pediatric anesthesiologists, and we invite subspecialists to join us for their input. Often nursing is there as well.
It's shared decision making in the truest sense, but decisions for surgery that are made with the family. Part of shared decision making is input from the non-surgical specialists who care for the patient.
And that only helps the patient's care. The idea that so many people are thinking about their case, thinking about every patient, helps the patient.
A lot of hospitals, the first time an anesthesiologist meets the patient is in the holding area right outside the OR. And that's rarely the case on our complex patients. They already have a relationship. Many times they're having their surgery with the same anesthesiologist who did their preoperative MRI, who met them at a preoperative conference. And it's not just that they know them, the patients and the families have a sense of trust and a sense that they've got an ongoing relationship with the anesthesiologist, which makes it easier for everybody on the team.
Yeah, trust is a huge component of this. It enables open communication. There's nothing like walking into an operating room when you know every single person and you trust them above all else. And that happens every single time you take care of any patient here at HSS.
I'm thinking of a case a few weeks ago where Kate comes to me on the morning of surgery and says that, or even 3 days before surgery on a patient, and says that we just don't think they're optimized, or they've got an ongoing upper respiratory infection, which is getting better, but it's just not appropriate to go to the OR. And I think it's good to have partners who can pull you back and sort of give you a reality check.
I think one of the things that's so unique about pediatric anesthesia at Hospital for Special Surgery is the way that we are a very specialized hospital, and we're a unique little niche inside of that hospital. And when it comes to anesthesia, we really benefit from all of the advances made in adult anesthesia. And because we're in close proximity to adult patients, we've been able to translate everything we do in grown-ups to children, and that's a huge benefit.
And I think on the medical side, we see the benefits of that. So patients can participate in their rehab programs sooner. They're usually feeling better. So on the medical side, we reap the benefits of your sort of groundbreaking pediatric anesthesia care. So our pediatric perioperative team is comprised of 3 board-certified pediatric attendings, all who have special expertise in the preoperative optimization of orthopedic patients, as well as the postoperative management as well. We have expertise particularly in postoperative pain management, and have worked closely with the surgeons, the nursing team, and the physical therapists to ensure that our patients are comfortable postoperatively.
I think it's a fairly unique environment where they're not just hospitalists, they're actually taking care of the patient before they get to the hospital and after they leave the hospital. For the duration of their orthopedic muscular care at HSS, they do end up with a single point of contact. It's not unusual for a single patient to have 5 different specialists throughout the city at different centers, and despite the value of common EMRs, that not most of the information isn't actually shared. It requires somebody to write letters, send copies, communicate, and really make appropriate decisions based on all the information. It's really the only way you can do it.